Welcome to Newsmax TV. I'm Kathleen Walter. Bedbugs are making a comeback in couches and bedding in homes and hotels across the country. How do you know if they're in your bedroom, and if so, what should you do about them? For answers straight from an expert, we turn to Newsmax health contributor Dr. Russell Blaylock, the editor of the Blaylock Wellness Report. Welcome to Newsmax TV, Doctor.
Well, thank you.
Dr. Blaylock, there's an aura of mystery surrounding bedbugs, in part because the blood-sucking parasites are so difficult to see. How is it that they're becoming a problem again?
Well, most of the experts are of the opinion two major factors. One is the widespread international travel, particularly from countries that have not been able to control their infestations, and the widespread pesticide resistance. These bugs have traditionally been controlled by DDT, but they're completely resistant to it, and they're resistant to pyrethroids. Most of your newer pesticides have no effect on the bugs, so they're traveling through international travelers, ending up in hotels and cruise ships and movie theaters and rental stores, incredibly, nursing homes, all sorts of places. So,
now, what happens when a bed bug bites, and how do you know if you've been bitten?
Well, these are extremely small bugs. They're very difficult to see. When they bite, they have two little prongs. One of the prongs injects saliva, which is an analgesic. It kills the pain, so you don't know you're bitten. And the other is the blood-sucking apparatus. So most people, about 50%, have no evidence that they've been bitten at all. They don't know it. Some people react to the saliva that's injected, and they develop itching, which can be quite severe in some people. In rare cases, they develop an allergic anaphylactoid reaction and can die from it. So it's a whole spectrum of reactions to it. They're infected with a lot of organisms. There's been some 27 pathogens isolated from bed bugs, but none of them seem to really transmit terrible diseases like they did in the distant past, things like typhus. It can cause mainly local skin irritation in people that are sensitive to the saliva.
Doctor, what should you do if you've been bitten, and what should you be looking for more specifically?
Well, usually you have itching and a red spot, but like I said, half people, they don't even know they've been bitten. There's a number of things that seem to help, mostly natural things. You can use witch hazel on it. Neem tree oil works very well. It kills the little bug, and it kills the egg as well, and seems to be tolerated on the skin. They make a neem tree oil shampoo for kids for the head louse, and these seem to work pretty well. There's a cedar-based treatment as well that seems to kill the organism, but the most effective appears to be the natural product.
Now, should our viewers be concerned about the dangers associated with some of these chemicals that are sometimes used to treat bed bugs?
Yeah, and quite a few experts are concerned because in hotels spraying these mattresses in the rooms with these powerful pesticides, particularly with the new evidence that pesticides are probably one of the leading triggers for Parkinson's disease, and also strongly connected to Alzheimer's disease. Most of these artificial pesticides are neurotoxins, and quite a few are carcinogenic. And they're carcinogenic and neurotoxic in very small concentrations.
Dr. Blaylock, let's talk about the home. How do you know if you have an infestation at home, and what are the safest ways to get rid of an infestation?
Well, there's some hints. If you see little blood smears on your sheets, that indicates you're being bitten. Sometimes you can see the droppings from the insects. They're very small little specks on the sheets as well. That indicates that you probably have an infestation. You can see them under a magnifying glass. They tend to get in the crevices of your mattress. The treatment of cleaning a room takes vigorous vacuuming. You have to vacuum your mattress and box springs and the whole room, every inch of it, to remove the bugs. Then you throw this vacuum bag away. You never open it. And steaming of the mattress, you have these portable steamers. You steam every inch of it. can kill the organism and the egg itself. One way with the sheets is to put them in a dryer and put them in high heat in your dryer for 20-30 minutes, and that'll kill the bug as well as its eggs. They have a number of products. One is called cedar side fogger, which is a cedar oil, and you fog the mattress and the area of the room that's infested, and it seems to work very well. The neem oil also seems to work very well.
Dr. Blaylock, last question. What advice would you give our viewers who travel? I mean, how do you protect yourself when you're on the road?
Well, it's very difficult. The main thing is, you can use a diatomaceous earth dust. This is just a fossil dust. It's a very small stone dust, and it cuts the insect shell, and they dehydrate and die very quickly. And you can dust your suitcase. You can carry this with you and put it on objects where you might be exposed. You can use the neem oil, bring that with you, and rub it on your skin. That kills the insects very quickly.
All right, Newsmax health contributor and editor of the Blaylock Wellness Report, Dr. Russell Blaylock, thanks so much for your insight and advice.
Thank you.
And thank you for watching Newsmax TV.